How can I do cardio with PAH if my oxygen use is already high during normal activity?
I appreciate this question so much because I live at what we would consider moderate altitude here in New Mexico, and many of my patients live at high altitude. And so they may already be requiring more oxygen than somebody who's at sea level. So I get this question a lot. Listen, I'm already on 4, 5, 6 liters of oxygen, and if I do exercise, it really drops quickly. Can I still safely continue to exercise? And this is a tough one because we definitely feel that there is room for exercise in that person's life, and it may just have to be modified for them. And depending on what their symptoms are, we may be able to tell them that for those short periods of time, if their oxygen is lower, but they are not symptomatic, that it would be safe for them. And again, this would be a conversation with your provider so that you know, is that safe for you? When it comes to oxygen, it's a tremendously important, I think of it as a treatment, a therapy that can be equally as successful as many of our medications. And when we combine them, we find that patients can do even better. And the oxygen needs really are keeping and helping open the blood vessels in the lungs so that it takes some of that extra strain off of the heart, and the heart doesn't have to work as hard. So when you're exercising, if your oxygen is dropping down some, the most important thing is that we keep it in a safer range, which probably we're not wanting it dropping down, into the low 80s and below for any long period of time. On the other hand, it's more important that the majority of your day is spent in a normal range of oxygen. Typically, that would be 88% or greater, so that we're protecting the heart and your body. And if there are moments that oxygen drops, that may not be as detrimental as I know sometimes it's scary to see that. And many of my patients often are checking their oxygen all the time. And I tell them that I understand their concerns, but I am actually more worried about their mental health side of it, always watching, always concerned, that in reality, we need to be less inclined to say, is it keeping it there all the time, and more inclined to discuss with the provider what's safe for you.